morning we did eliminate 70 licensed practical nurse positions at Akron General Medical Center. This is a little less than half of the 152 LPNs we have totally in our system, and these are nurses who are just on the inpatient side of care at Akron General Medical Center.
Can you tell us why some of these layoffs were made?
Yeah, they were made so that we would be really consistent with local and national trends in the healthcare workplace. I mean, the reality is that acute care hospitals such as Akron General are converting to all RN staffs, which offer a more educated workforce with superior skills and training. Nowadays, patient care is becoming so much more complex, and patients are sicker and sicker as they're coming in the doors and being admitted. And so we, just like all other hospitals across the country, really must offer medical and nursing staffs that are able to provide the highest level of care, and that's where the RN comes in, and those with advanced degrees. So we're doing it basically to improve and enhance patient care at Akron General Medical Center.
How exactly will that help improve, though, if you're actually laying off some of the nurses?
Well, we're replacing positions with registered nurses, so it is not an economic decision. It's a level of care decision, if you will. So LPNs who were let go ultimately are being replaced with registered nurse positions. So the care will be enhanced, not diminished in any way.
So of those 70 jobs that are being laid off, will those all 70 be replaced?
No, it's hard to say specifically. We've already replaced about 20, but nursing units, fluctuate with volumes, so it's hard to give an exact number of it's not a one-to-one comparison, but we expect ultimately that there obviously will be no impact on patient care, no delays or any sort of problems in delivering service.
So 20 jobs have been replaced so far?
Correct.
Do you know if there's any more layoffs that are being planned relating maybe even to this circumstance or?
No. No, and again, this is an unfortunate situation. Anytime, whether it's 70 or 700 people, it's a very, very unfortunate situation. And we're working with each of the LPNs individually to help provide some counsel and referral and severance and things like that. But no, this is not. There's no other layoffs planned or anything like that because it's not anything. It's not a financial decision.
Was it possible to offer some sort of further training or education for those who are LPNs to become a registered nurse?
Sure. I mean, that's obviously, I think some of them are already doing that, and they would be, once they would complete those requirements, that's, possible, I suppose, that they could, reapply for positions throughout the city. Akron General is committed to providing, cost-effective, high-quality services to our community, and we have to, really look at how we're providing care and how to provide it at the best level with the best people at the bedside, and so that's what we're doing here today.
What exactly made Akron General determine that registered nurses were needed as opposed to the LPN?
Sure. I mean, I think the research has been staring us in the face for quite a while. There's no question. If you were to look at national research, it shows clearly that all RN staffs, those hospitals have decreased mortality and morbidity and better outcomes with the patients. So it's a patient care decision. We want our patients to come in, be treated exceptionally well, and go home feeling all better. So that's what this is all about. And this is just one piece of providing optimal care for the patient.
Was this based on research outside of Akron General, or was this?
Yeah, this is national research.
Mm-hmm. Mm-hmm. And was that made your decision, or did you actually also look at your Akron General and the care that the patients were getting, and you kind of came to that decision that registered nurses would be more
Right. It was a combination of local and national and individual, sort of introspective looking at what we're doing here and how to provide even better care. We're involved in a whole new model of care called relationship-based care, and it's a whole interdisciplinary model of care that really places the patient at the center of everything we do, and the goal of it is to provide the safest and highest quality patient care. So, that just involves the nursing and the medical staff, and all with how they develop relationships among each other, and ultimately with everyone thinking 24/7, how can I make this patient experience better? How can I make this patient feel better? And so and relationship-based care has been in place here for probably going on about 3 years now. So, this is just a culmination of things to keep enhancing our care.
For those who don't know, can you just clarify what an LPN is as opposed to a registered nurse?
It's a licensed practical nurse as opposed to a registered nurse, and generally the training, it's like a 1-year program to get an LPN, whereas an RN usually studies for 2 to 4 years, and then many of them go on for advanced degrees after that.